So we've changed our venue this morning, but we're going to go back to kind of approaching some of the issues and interesting topics in EMS. So one of the things we wanted to do at least every round or once a month was kind of try to cover one of the newer drugs that have been added to the state drug list, or one of the changes relative to maybe medications being on back order. So what we kind of wanted to talk about this morning was the change or the add in Versed, or putting Versed on the drug list kind of in place of Valium or for use with seizures. And so kind of what was the idea or the thoughts behind using Versed?
Well, I think Versed is probably a better drug than the diazepam or Valium. And obviously, as you mentioned, one of the reasons that we added the Versed in the first place was that we were having difficulty getting Valium because of drug back orders. But in saying that, many of the neurologists, especially here at DCH, do not want us using Valium. They do not think Valium works very well for stopping seizures. They said it wears off, and they like the Ativan or Versed better than they do, the Valium. But I think Versed actually is a better drug because it is easier to give. You really don't even have to start an IV for Versed. You can give them intranasal, and intranasal is something that is gaining popularity with Versed throughout the EMS community. Many of the larger services are going straight to an intranasal Versed for seizures rather than starting an IV. And I think Versed is one of those drugs that, because you can give it intranasal both to pediatrics and adults, it's easy to train in the intranasal Versed use. No IV. It's relatively painless because you're not having to start an IV or give an IM injection. And the biggest thing is, from a safety standpoint, is no risk of needle stick. So I think Versed is probably a better drug for EMS use than the Valium. Most of the neurologists, like I said, around here really are pushing the Versed or Ativan rather than the Valium. With that being said, there are also other EMS agencies that are actually giving, and this is an aside, actually giving Keppra or some medication as an actual seizure medication. It will stop it, not quickly. The Ativan, the Versed will stop it very quickly, but then they're, especially on long transport times, they're actually starting to load them with Keppra. Now that's an aside that we're not doing, but I think with the Versed, it has multiple uses. Our primary use here, obviously, is seizure treatment. But you can use it for RSI induction medicines. You can use it for combative patients. And as I mentioned before, with one of the other talks, you have to be careful using any benzodiazepine with combative or excited delirium patients, simply because, as I mentioned before, you have a compensatory mechanism of that tachycardia. And if you take that compensatory mechanism away, you increase their risk of cardiovascular collapse. So I think that you have to be careful with excited delirium. Now, have I used it? Absolutely, I have. But I think you have to be careful with that. I think there are better drugs out there. I think the ketamine is a better drug for that. But overall, I think from what we do every day as far as treating seizures, I think Versed is probably the drug that we ought to be using. Remembering again that, as a general rule, about 2 milligrams in a patient, in an adult patient, intranasally, IM, IV, and in the pediatric population, 0.1 milligram per kilogram IV or IM. Again, slow IV push, 0.2 milligram intranasal, up to about 5 milligrams total max dose. And all those are Category B drugs, as we know through our protocols. But overall, again, recapping, I think that it is a superior drug to what we have carried before. Now, there's some contraindications that you need to, or cautions that you need to keep in mind. Glaucoma patients, if you know that they have glaucoma, there's a theoretical risk that Versed will increase intraocular pressure, so you have to be careful with that. Two, those that are have been using alcohol, it will sedate them more and theoretically reduce their respiratory drive. Same way with somebody that's already comatose. I'm not really sure why you would really want to use it, but sometimes if they're agitated, although they're really not very responsive, you have to be careful with that, as I mentioned. Pregnant patients, and really and truly, if you read the literature, if there are other medicines that you can use other than Versed in a pregnant patient, you really ought to use that because it's a category D drug in pregnancy. So just keep those things in mind. Sometimes there's not a better drug or a different drug that you can use in the pre-hospital setting. So those are things that I would keep in mind and as a general overview of Versed. But again, I think Versed is certainly a superior drug for pre-hospital use than the Valium.
All right. A couple of things that for me come to mind. You mentioned the pregnant patient, so certainly you can have seizures with eclampsia, preeclampsia, that kind of thing. Pediatrics, when you give what I would consider a stronger medication, that will always worry me. But the other thing that comes to mind with me, if we're carrying Versed, is there any risk now of us carrying Romazicon? Is that something that is on the radar from a state perspective? Not necessarily to treat what we might use, but you have a lot of benzodiazepine issues, people taking Xanax overdoses, that kind of thing. So I caught you off script a little bit, but is there any danger of us carrying Romazicon?
Yeah, a huge danger, because if you have someone that's on chronic benzodiazepine use and they overdose on benzodiazepine, what we really need to do is support their cardiovascular and respiratory system, ventilate them, treat their hypotension, because one of the things I haven't talked about with Versed, and really with any of the benzodiazepine, but especially with Versed, is it will really cause some hypotension. So that's one of the reasons that you don't, that some people steer away from it for an RSI induction drug, is because it will cause some hypotension.
Right.
And with those head injury patients, you certainly don't want them to be hypotensive, as we've talked about before. But with the Romazicon, if you have someone that's on chronic benzodiazepine use and they've overdosed, and you give them the Romazicon, then you're taking away that sort of prolonged and chronic benzodiazepine use, and they've got an interaction with the GABA receptors. And then if you give the Romazicon, then you're blocking those GABA receptors, and you can actually cause them to have rebound seizures. So that's a bad drug for EMS
Gotcha.
use.
That was my, because you're carrying a drug, and should you carry its antidote? Theoretically, should you carry its antidote? But there's really more risk.
Absolutely.
To using that in the
it's a bad
pre-hospital
drug.
setting.
Even someone that comes in the emergency department that has overdosed on benzodiazepines, and we know they've overdosed on benzodiazepine. We support the respiratory
Gotcha.
system. We don't give them that. About the only time we'll give Romazicon, if we give somebody Versed or Valium or whatever benzodiazepine for procedural sedation, and they're for some reason they're just not waking up as quickly as we think, then we may give them some Romazicon, and that is few and far between. I can count on my one hand in 20 odd years of practicing that I've given Romazicon. We just don't do that.
Interesting.